Welcome. Today we're going to speak about Cestodes. Other name of Cestodes is tapeworms. And first of all, let's briefly revise structure of these parasites. Body of the adult worm composed from small head, short neck and quite long trunk. The name of the trunk is strobila and small head, usually called scolex. Let's look on the scolex in more details. Scolex is actually organ of attachment of this parasite, and it may be equipped with cup-shaped suckers, like this, or with the hooks, like this. Also, there may be so-called grooved suckers or botria, like this. What else should we know about the scolex? Scolex is connected to the trunk through the neck. And trunk composed of a chain of the segments. Other names of the segments are proglottids. So when you hear word proglottid, you should understand that this is a segment or small unit of a trunk. And here you see a schematic illustration of the scolex, neck, and trunk that is composed of chain of the segments. Each of these segments is called proglottid. Neck is location of generation of new trunk segments. So these new trunk segments, they are derived from the neck. And you may see here how it happens. This is schematic illustration of a tapeworm, and here you see that its trunk has anterior part, so-called middle part, and caudal part. Anterior part composed of not mature segments, while middle part composed of mature hermaphrodite segments. They are capable of fertilization. That is why caudal segments, they have eggs inside of the uterus. Another name of these caudal parts of the segments with the eggs inside of the uterus is gravid proglottids. So gravid proglottids are those segments of the trunk that has eggs inside. Digestive tract in tapeworms is absent and nutrients transported through the surface of the body. A reproductive system of the tapeworm, they are hermaphrodites, and male and female organs present in the same body segment that makes possible safe fertilization and cross-fertilization between segments of the same worm. Life cycle. When we speak about life cycle of the tapeworms, we should keep in mind that these guys are biohelminths, and they have intermediate hosts and definitive host. And how they, let's say, transferred from one host to another host, definitive host will produce an egg, and through this egg will occur infection of intermediate host. So how to determine who is definitive host? Definitive host is an organism inside of which produced egg of the tapeworm. Inside of the egg are located immature form of the tapeworm that is called oncosphere. And oncosphere equipped with hooks. Inside of the intermediate host, this oncosphere, that is one immature form, will be transformed to another immature form that is called fin. So we may consider that both oncosphere and fin, they are immature forms, but they may have very different morphological properties. Yeah, so as you see in this notion that oncosphere and fin, they both are immature forms of the parasites. In general, immature form of the parasites called larva. So they both could be called larva, but larva can be either in the form of oncosphere or in the form of fin. Let's look on the fin in some more details. Fins can be of different morphological types in different tapeworms. Some tapeworms produce fin in the form of cysticercus. Another produce fin in the form of cysticercoids or Echinococcus cysts or alveolar Echinococcus cysts, coenurus, plerocercoid. When we speak about intermediate host, this fin, it will be transferred from intermediate host to definitive host. And there, inside of the organism of definitive host, fin will be transformed into mature form of the parasite. So, inside of the intermediate host will be located so-called larva or immature form of the parasite. Initially it is oncosphere and then it will be transformed into the fin. Then fin somehow will be transferred into definitive host, and inside of the definitive host this fin will be transformed into mature form of the parasite. And then mature form of the parasite will generate eggs, and these eggs will make next round of the circle. They will be used for infection of next intermediate host. So here you may see very simplified basic scheme of the life cycle of tapeworm. Inside of the definitive host, mature form of the parasite will produce eggs. Eggs will be used for infection of intermediate host. Inside of the intermediate host, oncosphere will be transformed into the fin, and then fin will be used for infection of definitive host. That is how it works. So we may say that eggs, they are infectious agents for intermediate host, while fins are infectious agents for the definitive host. Now let's look on the flatworms from the perspective of their classification. Phylum is called flat helminths, and inside of the flat helminths there are classes Trematodes and Cestodes. Particularly in this video lecture we will focus our attention on Cestodes. Cestodes has certain types of the species in this class, particularly Taenia solium, Taeniarhynchus saginatus, Hymenolepis nana, Diphyllobothrium latum, Echinococcus granulosus, and Alveococcus multilocularis. These are those parasites that we will speak about in this video further. So let's look on Taenia solium. Another name of this guy is armed tapeworm or pork tapeworm. Geographical distribution of this parasite is unfortunately worldwide, and definitive host is a human. Location inside of the definitive host of the adult form of this parasite is intestine. You should keep in mind that Taenia solium located inside of the human body in the intestine. And when this happens, we consider human as definitive host. What about intermediate hosts? Intermediate hosts are pigs, also dogs, cats, and could be also humans. And location of the fin in the intermediate host, muscles. Also, fins could be located in the brain, in the eyes, and in other internal organs. Morphological type of the fin of the Taenia solium is called cysticercus. So, cysticercus is special morphological type of the fin, and fin itself is, generally speaking, immature form of the Taenia solium. Disease is called teniasis when we speak about adult form, and another type of disease that caused by immature form of this parasite is cysticercosis. So when human is infected with adult worm, we will say that the disease is teniasis. But when human appears to be intermediate host and infected with fins, This disease will be called cysticercosis. This is a schematic illustration of this parasite. It looks quite scary, and it can reach up to 2 or 3 meters in the total length inside of the intestine of the host, or in some exceptional cases even up to 6-8 meters. If we will look on the scolex of this parasite, you will see that it is equipped with hooks and with suckers. Of course, here you see only 3, but actually the number of suckers are 4. One is just hidden from other side of this illustration. Fin. Here you may see a schematic illustration of how fin of this parasite looks like. And this fin, or I would say in other way, morphological type of this fin is called Cysticercus. What about life cycle of Taenia solium? As it was mentioned above, definitive host of Taenia solium is a human. This means that inside of the intestine of infected person will be located, unfortunately, mature parasite capable of production of the eggs. And then eggs that were produced inside of the definitive host will be released to external environment, for example with fecal material, and then these eggs could be further transferred into intermediate host, particularly into the pig. What will happen next? Inside of the stomach of intermediate host, eggs will be kind of digested, and oncospheres will be released. And this immature form, and once again I want to point your attention that immature form of these parasites, they represented by 2 subforms. One subform of immature stage, let's call it like this, is oncosphere, and this oncosphere can be transformed into the second order immature form that is called fin. But both of them, oncosphere and fin, they both are immature forms of the parasites. So, oncospheres released in the stomach, they will be next transferred into the blood. And there, through the blood circulation, oncospheres will arrive into the muscles. And there, inside of the muscles, oncosphere will be transformed into the fin. But both of them are immature forms of Taenia solium. So let's go once again. Inside of the stomach of intermediate host will appear oncospheres. They will be transferred into the blood, from the blood into the muscles, and there, when they will reach muscles, they will undergo through morphological changings and will be transformed into the fin. Here you may see enlarged schematic illustration of how fin of the Taenia solium looks. Name of this morphological type of the fin is Cysticercus. Here you may see miniature neck and very, very small scolex. So here you see kind of minimized initial structure of the future mature worm, with tiny neck and tiny scolex. The diameter of Cysticercus is from 5 to 15 millimeters. So, when person will eat meat of the pork infected with Cysticercus of Taenia solium, inside of the small intestine of the human, Cysticercus will be transformed into adult worm. This takes approximately 70 days, and this parasite may lead for a remarkable long time period. If it will be not treated appropriately, Taenia solium may live inside of the intestine of the person, leading to suffering of this person for 25 years or even more. And in this concept, human will be considered as definitive host of this parasite. But at the same time, human may be also an intermediate host of the parasite. And now comes question how human can be infected not with the fins but with eggs of Taenia solium. One option is water and vegetables that are contaminated with the eggs. But there is another possibility to become infected with the eggs. Some segments of the big adult worm will detach from its trunk and transported into the stomach. In this case, segments will be digested and eggs will be released. In both of these situations, then oncospheres may be transported into the muscles, brain, eyes, and other tissues of the patient. So unfortunately, when a human is infected with Taenia solium, initially as a definitive host, this may lead to further worsening of situation if some of the segments of this parasite will be transported into the stomach, eggs will be released, and then eggs will give rise to oncospheres that will go through the blood circulation to different locations of the body, like muscles, brains, eyes, and so on. And in this case, a patient can be simultaneously intermediate host and definitive host. Now let's speak about pathogenicity of the Taenia solium. So this is adult worm again, and name of the disease that is caused by adult worm is Taeniasis. Pathogenic mechanisms are mechanical injury of the intestine. Also, this worm will kind of steal nutrients from the patient, and it may lead to formation of pathological intestinal reflexes. And this is one of the reasons how segments of this parasite could be transported in opposite direction from the intestine into the stomach. All this may lead to abdominal discomfort, to diarrhea, to constipation, to loss of weight, to the weakness, anemia, and fatigue. And now let's speak about another scenario when problems inside of the human body created by the fin of Taenia solium. When main pathogenic element is the fin, disease is called cysticercosis. So what are pathogenic elements of cysticercosis? One of the main pathogenic mechanisms is mechanical compression of tissues, and clinical manifestations will depend on the location of the fin. For example, you may imagine how dangerous it may be if this fin will be located, for example, inside of the brain. How to diagnose this pathology? How to diagnose Taenia solium infection? One possibility is to demonstrate mature segments of the parasite of the fecal material. Also, one may try to demonstrate eggs, or another way of diagnosis is post-treatment demonstration of the scolex to confirm initial diagnosis that it was correct. How to diagnose if main element of the disease is the fin of Taenia solium? In order to diagnose cysticercosis, X-ray scanning could be used to identify fins inside of the organs of the human body. Also can be used more precise method like computer tomography. Also could be used immunodiagnosis or biopsy. How to prevent this disease? A professional examination of meat in the markets is necessary. Also should be done prevention of water and soil contamination with fecal material, and of course should be performed identification and proper treatment of infected persons. Also, it is not recommended to eat raw or undercooked pork. Now let's speak about another parasite that is called Taeniarhynchus saginatus. Another name of this parasite is not armed or beef tapeworm. Geographical distribution is again worldwide. Definitive host is human. Location small intestine. This is location of the adult worm. Important to understand that we have to know location of adult form of the parasite in the human body, and also we should understand what is the location of immature form of the parasite. So location of the adult worm is small intestine of the human. Intermediate hosts cows, buffalo, and location of the fin again inside of the intermediate hosts is muscles. Inside of the intermediate hosts, fins located in the muscles, while inside of the definitive host, adult worm will be located inside of the small intestine. Morphological type of the fin of this parasite is again called Cysticercus. Disease is named Taeniarhynchus, and it is caused by adult worm. As you see here, human could not be an intermediate host. That is why this parasite may be a source of disease only caused by the adult worm, but not by immature form of this parasite. Let's look at the morphology of this parasite. It looks a little bit similar to the previous one, but the scolex is different. It can reach up to 12 meters long, and you see that there are no hooks on the scolex. Instead of them, there are 4 suckers. That is why it is called not armed, because it does not have hooks. Human could be only definitive host of this parasite, and when a mature parasite resides inside of the intestine, it will produce eggs, and these eggs will be released into external environment, and there from external environment eggs could be transferred into the cow, and this animal will be intermediate host of this parasite. Inside of the stomach of intermediate host of the parasite, oncospheres will be released and transferred from the stomach into the blood. From the blood they will reach muscles, and inside of the muscles, oncospheres will be transformed into the fin. Once again, fin will have morphological type that is called Cysticercus. Its diameter approximately 9 millimeters, but this is not something that you should really remember clearly about this disease. When person eats infected beef, inside of the small intestine, fin will be transformed into the adult form of the parasite. This transformation from the fin into the adult form of the parasite takes approximately 4 months. And important point here that eggs of Taeniarhynchus saginatus are not infective for the human. That is why there will be no cysticercosis caused by Taeniarhynchus saginatus. And that is why human could be only definitive host for this parasite, not an intermediate host. Pathogenicity of Taeniarhynchus saginatus. This disease, once again, caused by adult worm, and it is called Taeniarhynchus. Pathogenic elements are mechanical injury of the intestine, stealing of the nutrients from the human, and formation of pathological intestinal reflexes. As it was in the case of previously discussed parasite, all this may lead to abdominal discomfort, to diarrhea, to constipation, loss of weight, weakness, anemia, and fatigue. In order to diagnose this pathology, could be performed demonstration of immature segments of the parasites in the fecal materials, or eggs could be demonstrated also with the help of microscopical examination inside of the fecal material. Or eggs could be identified on the skin around the anus. How to prevent this disease? Professional examination of meat on the markets is something that absolutely necessary. Also should be performed prevention of water and soil contamination with fecal materials, and also should be done identification and treatment of infected person. And once again, don't eat raw meat or not properly cooked meat. Now let's speak about another parasite that is called Hymenolepis nana, or dwarf tapeworm. Geographical distribution is worldwide, definitive host is human, and location of the adult worm inside of the human body is intestine. Intermediate host also unfortunately could be human, and location of the fin of immature form of the parasite is intestinal villi. So here you may see magnified illustration of internal space of intestine, and you may see here nice schematic representation of the intestinal villi. Morphological type of the fin characteristic for Hymenolepis nana is called cysticercoid. Disease is called hymenolepiasis. Let's look on the schematic illustration of this parasite. It is not so long as previous. It is approximately 20 to 40 millimeters of the total length. It is equipped with hooks and suckers. And this is schematic illustration of the fin. Name of morphological type of this fin is cysticercoid. What about life cycle of this parasite? This parasite can be transferred from one human to another human because human could be intermediate and definitive host, and because of this it is called anthroponosis. I hope you remember from our very first lecture that when parasites circulating among the people, we call this type of disease anthroponosis. So let's start revision of the life cycle of Hymenolepis nana. Let's imagine that we see a patient who is definitive host and eggs released from the body of definitive host into external environment. Then, with the help of insects that serve as mechanical vectors, eggs could be transferred to the food. And then another person could be infected with contaminated food. From this schematic illustration, we see that in this scenario, when person will be infected, this patient will have oncospheres inside of the stomach and inside of the intestine. And having oncospheres inside of the gastrointestinal system, and we remember that oncospheres are not mature form of Hymenolepis nana, we will consider this patient so far as an intermediate host, because so far this patient has only oncospheres, only not mature form of the parasite inside. Inside of the small intestine, oncospheres will be released and then they will integrate into the villi of the small intestine. So far, at this particular moment of infection development, only immature form of the parasite is present inside of the human body, and we will consider such patient as intermediate host, because so far there is no adult worm. What will happen next? Oncospheres will be transformed into another immature form that is called cysticercoid. And this takes approximately 4 to 6 days. And then this cysticercoid will give rise to mature form of the parasite. Its development takes approximately 14 to 15 days. What will happen next? This parasite will generate new eggs, and these new eggs could be released with fecal materials. And in the water, eggs may stay infective up to 4 weeks. And lifespan of the parasite is approximately for 2 months. But disease could last longer. You see here mature parasite, and let's consider that its lifespan limited only for 2 months. So actually after 2 months this particular parasite will die. So why disease can last longer if this parasite will die in 2 months? The problem is that this parasite may release eggs, and these eggs may lead to next round of infection inside of the intestine of the patient. So when this particular parasite will die, eggs that were released from this parasite may lead to new round of infection and formation of new parasites. And this may occur again and again in a circle. That is why, despite relatively limited lifespan of each particular parasite, the disease may last for a long time. What about pathogenicity of Hymenolepiasis? Of course, in this case, when person is infected with this parasite, may happen mechanical irritation of the intestine. Also, unfortunately, may happen destruction of intestinal villi, and this may lead to abdominal pain, to diarrhea, to weight loss, to headache, allergic rash. In order to diagnose this parasite, should be performed demonstration of the eggs in fecal material. In order to prevent this pathology, it is important to keep personal hygiene, to wash vegetables and fruits, and boil water. Also, of course, it is important to perform examination of people who live together with infected person, because this disease may spread from one person to another person, as it was mentioned previously. Now let's speak about another parasite that is called Echinococcus granulosus. Echinococcus granulosus, or hydatid worm, its geographical distribution worldwide. Definitive hosts are dogs, wolves, jackals, and other animals, and location of the adult worm inside of the definitive host is an intestine. Intermediate hosts, human, sheep, and some other animals. What does this mean? This means that inside of the human body, pathology may be associated not with the adult form of this parasite, but with the fin, with its intermediate form. And this fin could be located in the liver, in the lungs, in the brain, kidneys, and other organs. So unfortunately, in case of being intermediate host, patient is under the danger of such situation when pathology will not be limited to the intestine as it was in case of the previous parasite, but multiple internal organs can be affected, because for Echinococcus granulosus, disease affecting human is associated not with the adult worm but with the fin, and fin could be located in different internal organs. Morphological type of the fin characteristic for Echinococcus granulosus parasite is called Echinococcus cyst. Once again, as I mentioned this previously, fin is general name of immature form of these parasites. But this fin or immature form of different parasites may have different morphological representations. And morphological representation of immature form of Echinococcus granulosus is called Echinococcus cyst. So fin of one parasite and fin of another parasite could be different. And particularly for Echinococcus granulosus, fin represented by morphological type that we call Echinococcus cyst. Disease is called cystic echinococcosis. This disease is caused by immature stage of the parasite. This is what you should remember about Echinococcus granulosus, that inside of the body of your patient, in this particular case, may be identified not adult worm, but immature stage of the parasite. And this immature stage of the parasite may be located in different internal organs. This is schematic illustration of how embryonated egg of Echinococcus granulosus looks like. It is quite small, but then this egg could be transformed into fin that is called Echinococcus cyst. It is much bigger, and you see that inside of this Echinococcus cyst there are quite a lot of tiny structure. For example, dotted cysts may be located inside of Echinococcus cyst. And here you may see even some proto-scolex of the parasite. Unfortunately, size of Echinococcus cyst may be quite big. Why unfortunately? Imagine dramatic situation if cyst with diameter, okay, let's consider not 20 centimeters, but few centimeters, will be located in the brain. This may lead to dramatic consequence for health of the patient. Or imagine how severe may be situation if cysts will grow further and will reach up to 20 or 30 centimeters. Of course, even if we will consider another locations, not the brain, but for example muscles or liver, relatively big diameter of the cyst may lead to more severe pathology for a patient. And here you may see a schematic illustration of how adult worm looks like. And the adult worm actually is quite small. Its length is not so big. It is equipped with hooks and suckers. And here you may see a schematic illustration of terminal segment of this parasite that contain eggs. Life cycle. Definitive host could be a dog, and inside of the body of the dog, since dog is a definitive host, parasite, adult worm, will be located inside of the intestine. And then with the fecal materials will be released eggs with oncospheres, that is immature form of the parasite. And then these eggs may be source of contamination of the water and food. And also eggs may contaminate hair of this animal. And also they may contaminate grass for further transmission, for example, to the sheep wool. In this schematic illustration, you may see that human may be infected drinking contaminated water and food. Also, in case of eggs will be located on the hair of the dogs, human may be contaminated through contamination of hands during contact with dogs. And in case if eggs will be transferred to the sheep wool. This may lead to contamination of hands during the work of people who work with sheep. In all of these cases of infection, human will be infected with eggs containing oncospheres, and in this case human will be intermediate host. So human will be infected not with the fin but with oncosphere, and if human is infected with oncosphere, human will become intermediate host. Inside of the intestine, oncospheres will be transferred from intestine into the blood, and then through the blood circulations, oncospheres may arrive into the liver, into the lungs, into the heart, and other internal organs. And then inside of these internal organs, oncospheres that are quite small, they will be transformed into the fin, second stage of immature form of this parasite, and unfortunately this fin may become quite big and may compress those internal organs where it is located. As you see, fin unfortunately may become bigger, and it may survive up to 20 years in the body of patient. At the same time, human body may try to protect itself from this fin and may create fibrous capsule around it. What about pathogenicity of this disease that is called cystic echinococcosis? One of the very obvious pathogenic elements is mechanical pressure on the tissues of the body, but also fin may be the cause of toxic actions and allergic action. Clinical symptoms, of course, depends on the location and site of the cyst. Very dramatic situation may happen in case if this cyst will be ruptured due to, for example, mechanical stress. In this situation may happen anaphylactic shock and spreading of infection. How to diagnose this pathology? For this, X-ray examination should be used. Also, it can be identified with ultrasound examination, computer tomography, and immunological method. But of course, it is much better to prevent than to diagnose, and prevention is much more simple than diagnosing and treatment. In order to prevent cystic echinococcosis, infection caused by Echinococcus granulosus, it is important to wash hand after contact with dogs or taking care after the sheep. Also, it is important to do very simple things. It is important to wash fruits and vegetables and to boil water. Now let's speak about Alveococcus multilocularis, another parasite. Its geographical distribution, it is prevalent in northern parts of the world from Siberia to Canada. Definitive hosts are dogs, wolves, foxes, cats, and inside of the definitive host, location of the adult worm is an intestine. Intermediate host could be a human, also mice and other rodents. Location of the fin, here human is intermediate host. This means that human could be infected with an egg that will give rise to oncosphere, and oncosphere will be transformed into the fin. And the fin will be the main problem inside of the human body. Location of the fin could be liver, lungs, brain, kidneys, and other internal organs. Name of a morphological type of the fin characteristic for Alveococcus multilocularis is alveolar Echinococcus cyst. Alveolar Echinococcus cyst, it is the name of the fin that is generated by parasite Alveococcus multilocularis. Disease is called alveococcosis. It is caused by immature stage of the parasite. Life cycle of Alveococcus multilocularis is similar to Echinococcus granulosus. Intermediate host can be infected with contaminated water and food or via contaminated hands after contact with dogs and foxes if someone has contact with foxes. Pathogenicity depends on the location of the cyst. Typical location is liver, but additional locations could be lungs, neural systems, and another internal organs. Alveococcus with multiple cysts in the human body may lead to death of the patient. So this is very severe situation that should be diagnosed in time and treated properly. How to diagnose? With the help of X-ray examination, ultrasound examination, computer tomography, and immunological methods. Prophylaxis: to wash hands after contact with animals, wash fruits and vegetables, and to boil water. Now let's speak about another parasite that is called Diphyllobothrium latum, or fish tapeworm. Why it is called fish, you will see when we will discuss its life cycle. So, Diphyllobothrium latum, its geographical distribution: Europe, North America, Siberia, Japan, Central Africa. Definitive hosts: human, cat, dog, pig, and location of the definitive host is an intestine. Intermediate hosts, and this is a little bit tricky for Diphyllobothrium latum because it has not one but two intermediate hosts. Intermediate hosts number one is cyclop. This is small water crustacean, but also there is important element in the chain of infection represented by second intermediate host, fish. And inside of the fish, location of the fin, muscles, and reproductive organs. Name of morphological form of the fin, characteristic for Diphyllobothrium latum, is plerocercoid, and disease is called Diphyllobothriasis. Diphyllobothriasis is disease of the human that is definitive host of this parasite, and when human is definitive host, disease is caused by adult stage of the parasite. So human could be infected as definitive host, and in this situation, inside of the intestine of your patient will be located adult form of this parasite. And the name of disease, once again, Diphyllobothriasis. So let's look on this parasite. Morphology: it looks like approximately like this, and this is the largest worm inhabiting intestine of the human. It may reach up to 9 meters in length, or even up to 20 meters in some extreme cases. This parasite, being so long, may have up to 40,000 of segments or proglottids. If we will look on the scolex of this parasite, we will see that there are no hooks and there are two grooved suckers. Name of the suckers: Botria. So you may see them here on this schematic illustration. Yeah, and no hooks. What about the fin? Fin is called plerocercoid and looks approximately like this. Its size is approximately 1 to 5 centimeters in length. Now let's look on the life cycle. It is a little bit more tricky than previous. Human is definitive host. This means that inside of the intestine of the human will be located adult worm generating eggs, and then eggs will be released into the water. Inside of the water from eggs will be released immature form of Diphyllobothrium latum that is called coracidium. And this coracidium will be taken by cyclop, first intermediate host of this parasite. And then inside of this cyclop, Parasitic will be transformed into another intermediate form called procercoid. And then this tiny cyclop carrying procercoid will be eaten by fish. And when this cyclop infected with immature form of Diphyllobothrium latum will be eaten by fish, inside of the fish this procercoid will be transformed into fin. And fin of Diphyllobothrium latum has morphological type that is called plerocercoid. And this plerocercoid will be located in the muscles, liver, ovary of the fish. And then this fish carrying plerocercoid will be infectious for a human. When human will eat such fish carrying fin of Diphyllobothrium latum, human will be infected with the fin, and then inside of the intestine of the human, fin will be transformed into adult worm. And adult worm, Diphyllobothrium latum, may survive it if not treated properly up to 20 years. Name of the disease that is caused by Diphyllobothrium latum is Diphyllobothriasis. And clinical manifestations are abdominal pain, diarrhea, loss of weight, fatigue, headache, and anemia. Anemia due to deficiency of vitamin B12. How to diagnose this disease? Diagnosis is performed with demonstration of body segments of this parasite or eggs in the fecal materials. And how to prevent this disease? People should avoid eating of raw or not properly cooked fish. And this is the end of our lecture about these parasites. Thank you very much for watching. I hope this video review of these parasites make these pathologies more clear for you.